In the first week of life, a perfectly healthy baby can have a brain bleed with no warning signs, and this is why. I'm Dr. Brittany Mitchell. I'm a board-certified pediatrician and a mom, and I break down complicated scientific topics in ways that are easy to understand for families and help them feel a little more at ease with everyday parenting decisions. Today, we're going to do a deep dive on one of the most asked about interventions in my practice, and that is the vitamin K shot. Today, we're going to talk about what vitamin K is and its role in the body, why newborns don't have enough of it, what the black box warning is actually about, what the research says about risks and benefits, and we'll talk a little bit about some myths that have been circulating online for years. I know many of you are weighing this decision carefully and you deserve real information. So let's get started. So first, what even is vitamin K? Vitamin K is a fat-soluble vitamin, and its superstar role, its primary function, is to serve in the coagulation cascade, which helps our blood clot. We can think of blood clotting like a relay race, and vitamin K is sort of the coach that activates 4 of the primary and most important relay runners. In this case, factors 2, 7, 9, and 10. If these factors don't get the signal to activate, that can lead to prolonged and even life-threatening bleeding events. Now here's where it gets really interesting. And once you sort of start to understand the science behind this, I think the conversation makes a lot more sense. Newborns are born in a naturally vitamin K deficient state. And that is not a flaw. It is just part of biology. And it's a reality that we need to account for as physicians and as parents. There are 4 main reasons for this. The first one is that vitamin K just doesn't cross the placenta very well. Even if mom's levels are great, this is just one of those things that doesn't go across the placenta, and we have to account for that. The second is that newborns don't have established gut bacteria to make vitamin K yet. So one of the primary places that vitamin K is made is in our gut. But when newborns are born, their gut is what we refer to as sterile. So as they eat and take in more of the bacteria in the world, their gut will naturally begin to make vitamin K. But when they are first born, that's simply not a reality. Third, breast milk is naturally low in vitamin K. So looking at 1 to 4 micrograms per liter. That is not enough to establish a good gut bacteria, especially in those early weeks. And breastfeeding is amazing, and I would always encourage it, but it is a nutritional reality that we have to be mindful of. Fourth, a newborn's liver is immature. So even if there are some circulating levels of vitamin K, it may not be able to be used efficiently to help a newborn's blood clot. Now, all of those things taken together mean that our newborns have about 30 to 60% of the ability to clot normally that we would expect an adult to have. And that leaves our infants very vulnerable in a very early time frame. And that is where the vitamin K injection comes in. When we give vitamin K at birth in those first few hours, what we're really working to prevent here is something called vitamin K deficiency bleeding. It also used to be called hemorrhagic disease of the newborn. There are 3 distinct forms of vitamin K deficiency bleeding, and these are categorized based on the timing. So the first form is called early vitamin K deficiency bleeding, and this usually happens within the first 24 hours. This is almost always related to maternal medications, especially those that are encouraged to prevent the blood from clotting normally. In these early vitamin K deficiency bleeding cases, bleeding can be in the brain or in the abdomen and is usually very severe. Now, classic vitamin K deficiency bleeding is probably the one that we are most familiar with, and this usually occurs within the first 2 days to 7 days of life. This may look like bleeding or oozing from the umbilical cord stump or at the circumcision site. You may notice it as easy bruising. It can also be GI bleeding, which is going to be a little bit more subtle and hard to pin down. We don't typically see intracranial bleeding in this population, although it is possible and it does happen. It is less common. And then we have late vitamin K deficiency bleeding. And this is the one that worries us the most because this happens between 2 and 12 weeks. So usually long after families have gone home, and it occurs almost exclusively in otherwise healthy breastfed infants who did not receive the vitamin K injection at birth. In a significant portion of these late vitamin K deficiency bleeding cases, the very first sign is going to be that intracranial or brain bleeding. So an otherwise healthy infant that had no problems can suddenly lose consciousness, have a bulging soft spot, or other severe signs of a brain bleed that we didn't otherwise know about. Vitamin K deficiency bleeding can occur in somewhere between 1 to 60 and 1 to 250 newborns. There's often no warning sign, and we can't tell with any kind of test or imaging what newborns are going to be at risk for this. Mortality from intracranial vitamin K deficiency bleeding is high, and survivors face a significant risk of permanent neurologic injury. So let's talk a little bit about what's actually in the vitamin K injection. The vitamin K injection that is given to newborns in the United States is a very small amount, so 0.5 to 1 milligram. And it is given into the thigh, usually intramuscularly, within the first 6-ish hours after birth. Now, if 1 milligram sounds tiny, that's because it is tiny. However, even at such a small dose, this is a pharmacologically significant amount of vitamin K so that it super saturates all of those receptors and helps our newborns in that most vulnerable period so that their bodies can clot effectively if they need to. It is important to note that the injection does this in a way that cannot be reliably replicated by oral dosing regimens. Oral dosing regimens do exist, however, they are less effective and require more frequent follow-up and really consistent dosing. And that in and of itself is really tricky when you have a newborn. Newborns might spit out or vomit up a dose. They might not absorb it very well. And even just keeping track of those doses across those early sleep-deprived newborn days is really difficult for families. Several European countries that had oral dosing regimens have actually transitioned back to the injectable form of vitamin K after seeing resurgence in late vitamin K deficiency bleeding and less protection for these newborns. As far as preservatives go, there are some formulations that contain a very small amount of benzyl alcohol, but that is not true of every formulation. We'll get to a little bit more about benzyl alcohol and why that is important to note in the next section. So you may hear a lot about the black box warning, and it's getting a lot of noise right now, but I want to demystify this for you guys today. The FDA black box warning states specifically that severe and life-threatening injection reactions have occurred when given in the intravenous form. Specifically, it calls out the need for us to administer this slowly and in any other way if possible. IV use should be reserved for when the risks clearly outweigh the benefits and there are no other options. Now, it is important to stress that the FDA here is talking about IV use, and the way we administer this to newborns is intramuscular, or IM. So these are not the same method of injection. As a result, the severe reactions that we're talking about when we look at that black box warning are not ones that we are concerned with when it comes to administering it to newborns. And if that sounds crazy, I want you to think about it like this. Root matters tremendously in pharmacology. Medicine that can be given in a patch might be toxic at doses when injected into the veins. And so when we're looking at this, the way our bodies absorb things based on the route of administration is incredibly important. This warning really exists to protect those patients who are receiving high doses of vitamin K, specifically in situations where we need to rapidly reverse things like anticoagulant medications or medications that help our blood from clotting normally. And that's usually we're looking at adults in trauma situations where there are no other options and the risk really does outweigh the benefit at that point. Serious adverse reactions in neonates is very uncommon, and this has been the standard of care since 1961 in the United States. When I think about the reactions that are likely to affect a newborn, it's the same typical players that we see: redness or pain at the injection site and maybe a little bit of swelling. And all of these are reactions I would confidently choose over a potential brain bleed. All right, so let's really quick debunk some myths that I see circulating online and that I talk about frequently in my clinic. The first is that the vitamin K shot contains toxic preservatives. Most often we're hearing this in association with the preservative I mentioned earlier, benzyl alcohol. Now, it is important to note that this is not part of every formulation, so this is sort of a case-by-case issue. This one is grounded in a little bit of truth because at high levels, benzyl alcohol can be toxic and can cause something called gasping syndrome. But this was observed in infants that were premature and cared for in a NICU setting many, many years ago, where they were receiving high amounts of medications that had benzyl alcohol in it. The very, very small amount of benzyl alcohol contained in most vitamin K dosing scenarios today is much, much lower than the amounts that those babies were receiving that led to that really scary gasping syndrome. And so when we look at the formulations we administer in hospitals around the United States now, this is a much lower, negligible amount of benzyl alcohol received in a one-time dose. That said, like I mentioned before, there are many hospitals that don't even use a formulation that has benzyl alcohol in it. So this may not be a concern for your individual formulation. Another myth that I'm hearing thrown around a lot is that vitamin K deficiency is normal and natural and therefore must be protective somehow for our newborns. This really sounds appealing because it evokes evolutionary biology. However, nature is not always the most kind, and we know that everything that is natural is not necessarily safe for us. The idea that is sometimes floated around is that we have low levels of circulating vitamin K at birth so that we don't clot in response to the trauma of delivery. Again, this sounds really nice, but it's not supported in the scientific literature, and there is no evidence that suggests that this is true. We do know that newborn vitamin K deficiency bleeding causes brain bleeds, and it doesn't protect against it. This ongoing narrative directly contradicts the clinical evidence and is really dangerous when it comes to preying on that fear for parents that are really just trying to do the best thing to protect their babies. And then there is always that myth that the oral drops are just as good as the shot. Now, I touched a little bit on this earlier, but it is important to reiterate that the oral dosing regimen simply cannot replicate at reliable levels the same level of protection that the injectable vitamin K dose does. This is not a matter of debate in the medical literature. As I mentioned before, several European countries that relied on oral dosing regimens have reverted to the better protection provided by the injectable form of vitamin K. The American Academy of Pediatrics also agrees and explicitly states that the injectable form is preferred to oral dosing regimens. So let me give you the bottom line as clearly as I can. The risk of not getting the injected vitamin K version will cause 1 in 60 to 1 in 250 newborns to experience an episode of vitamin K deficiency bleeding. This risk remains until up to 6 months, with the majority of cases occurring between 2 to 12 weeks of life. Of those children who unfortunately experience an episode of vitamin K deficiency bleeding, 30 to 60% of these newborns have the first sign of this condition be a catastrophic bleed into the brain. Mortality is high, and those that do survive face permanent neurologic injury. Now, the risks of getting the shot. Serious adverse reactions like serious allergic reactions are exceptionally rare. We're talking case reports only. The other things that we would consider are redness, swelling, or pain at the injection site, as is possible with any injection. When we think about benzyl alcohol, that is a very small portion of the injection, and it's a negligible amount when we're thinking about the consideration of gasping syndrome. Honestly, this is one of the most clear-cut interventions in all of newborn medicine. The risk benefit is obviously in favor of receiving the vitamin K injection to best protect our babies in this most vulnerable time. The intervention is low cost, highly effective, and one time, and the condition it potentially prevents is catastrophic and life-changing. So if you take nothing else from this video, I hope you know a little bit more about vitamin K than you did when we started. Now you understand the mechanism of action, you understand the risks and the benefits, and you have all the tools needed to make a decision with your qualified healthcare professional. As always, the best conversation you can have is the one with the pediatrician or physician that knows you and your family the best and can navigate the ins and outs of this discussion with you. If this was helpful, I hope you'll stick around and subscribe and check back for more content. I hope to see you in the next one.